Hey there, welcome to the UCT, Chem OSE Units channel. Today, we're diving into a topic that doesn't get attention, ototoxicity. Now you may be thinking, what on earth is ototoxicity? I'm Prof. Indy Jones. Settle in as I break it down for you in simple terms. The word ototoxicity can be broken into two parts, oto meaning ear and toxicity meaning poison. So it literally means ear poisoning. Ototoxicity refers to the harmful effects that certain substances can have on our ears and our hearing. The scary part is that ototoxicity can often go unnoticed until it's too late, as the damage can be cumulative over time. Before we move on, I'm going to go through the structure of the ear. The ear is divided into three parts: the external ear, which is the part you see, the middle ear, which contains the three bones, the hammer, malleus, anvil, incus, and the stirrup, stapes, and finally the inner ear, which is made up of the cochlea, which is responsible for hearing, and the vestibule, which is responsible for balance. Ototoxins, which are responsible for ototoxicity, can damage the delicate hair cells in the cochlea, responsible for translating sound waves into electrical signals that our brain can understand. Little is known how the ototoxins actually damage the vestibule and cochlea, but is what thought to happen as the ototoxins cross the blood labyrinth barrier between blood and the inner ear, and end up accumulating in the vestibule and cochlea. Furthermore, they are unable to go back into the bloodstream and therefore be removed. So the person continuously being exposed to the ototoxins will cause more and more damage to the inner ear. How do you know when you are suffering from ototoxicity? What are the symptoms? Health effects caused by ototoxic medications and chemicals vary based on exposure frequency, intensity, duration, workplace exposure to other hazards, and individual factors such as age. The risk of hearing loss increases when persons exposed to ototoxins are also exposed to elevated noise levels. This combination often results in hearing loss that can be temporary or permanent, depending on the level of noise, the dose of the medication or chemical, and the duration of the exposure to both the ototoxins and noise. The signs and symptoms to look out include: when ototoxins damage the cochlea, the symptoms may vary from tinnitus, a ringing in the ears, in mild cases, to varying degrees of hearing loss, either in one or both ears, which usually presents the difficulty of hearing high-frequency sounds. When the ototoxins damage the vestibule, the symptoms go from a mild imbalance such as feeling dizzy to worst-case scenario, complete incapacitation where a person cannot even get out of bed. All of these ototoxins are well-known medications which have ototoxicity side effects when you take them. The damage can be reversible or permanent, and this can be linked to how long and at what dosage of the medication you are exposed, and it can even be worsened if you are exposed to noise whilst on these medications. The first set of medical drugs are loop diuretics, which are used to treat fluid retention. An example of this type of drug is bumetanide. When using this medication, the damage is not permanent. The next group of medical drugs are the aminoglycosides, which are used as antibiotics to treat bacterial infections. An example of this type of medicine is gentamicin, which can cause permanent hearing damage. The next group of medical drugs are the non-steroidal anti-inflammatory medicines, for example ibuprofen and aspirin, as well as other over-the-counter medicines. The damage caused by these drugs are reversible. The final set of medical drugs are the platinum-containing anti-cancer drugs. The most well-known is cisplatin, being used to treat cancers since 1970. The damage caused by these drugs is permanent. Apparently, cisplatin can still end up in the cochlea after 30 years. These are the lesser-known substances that can cause ototoxicity. It has been discovered that certain malaria-treating drugs also cause ototoxicity. These include quinine, chloroquine, and quinaldine. The final category are laboratory research chemicals. Many of the chemicals are commonly used in a chemical laboratory, such as organic solvents, for example butanol, N-hexane, toluene, to name but a few. Many researchers could be exposed to ototoxicity unknowingly. So how do the ototoxins get into our bodies? There are four possible routes of entering the body: inhalation, which is breathing it in, skin absorption going through the skin, ingesting by eating it, or by taking medication, Injection, like medication injected or on drip, adding it straight into the bloodstream intravenously. In a chemical laboratory, the routes we are interested in is mainly with inhalation and skin absorption. In a work or research environment, the first step is to identify if a person working with any ototoxins. This is where risk assessments become highly important and useful. It is expected that researchers routinely carry out hazardous chemical agent risk assessments to identify if they are being exposed to ototoxins. These risk assessments will identify ototoxins by studying Section 11 of the various chemicals safety data sheets. Ototoxins are usually indicated as neurotoxicants. If a person is identified of being exposed to an ototoxin, they need to be declared to the occupational health unit to ensure health monitoring takes place. The person exposed to a known ototoxin need to be monitored. This would involve undergoing a hearing test to get a baseline reading and repeated hearing tests at regular intervals to see if the hearing deteriorates. The next step is treatment. It is important to see if the person could eliminate their exposure to the ototoxin by discontinuing and using the chemical or taking the specific medication. If not possible to discontinue, can the exposure be reduced by taking a lower dosage and/or limited by working in a fume hood and wearing extra PPE? In some cases, ototoxicity may be unavoidable due to the nature of the medication that need to be taken. In these instances, it's important to work closely with the healthcare provider and the employer's occupational health unit to monitor hearing health and take steps to mitigate any potential damage or exposure to loud noises and a noisy environment. If hearing deteriorates, the person can wear a hearing aid or even a cochlear implant to help with the hearing. Now, you may be wondering, are there any natural ways to protect your ears from ototoxicity? While there's no guaranteed way to prevent it entirely, there are a few things you can do to support your hearing health. First and foremost, be mindful of your exposure to ototoxicants and loud noises, as noise-induced hearing loss can compound the effects of ototoxicity. Therefore, ensure you work in an environment with good extraction and wear the prescribed personal protective equipment and clothing. Additionally, maintaining a healthy lifestyle that includes regular exercise, a balanced diet, and proper hydration can all support your overall health, including your ear health. Some studies have also shown that certain nutrients like omega-3 fatty acids and antioxidants may have a protective effect on the ears, so be sure to incorporate plenty of these into your diet as well. To summarize, it is important to note that there are many ototoxins used frequently, both as medication and in chemical laboratories. It is important to introduce close monitoring for everyone who is exposed to ototoxins. Ototoxicity is a serious, but often an overlooked issue that can have lasting effects on our hearing health. By being proactive about monitoring the substances you work with, the medication you use, and communicating with your occupational health unit and personal healthcare provider, and making healthy choices in your daily life, you can help protect yourself from the potential dangers of ototoxicity. That's all for today. Thank you for watching. Don't forget to like, comment, and subscribe for more informative content on all things connected to laboratory and health and safety.